Welcome back to our Monday tutorial with Plan Womb Nigeria. Ovulation is the release of an egg from the ovary. Now, almost every woman I've met tells me that their ovulation occurs on the 14th day of their menstrual cycle. That's because it's all they've always been told, but this is not always the case. In the Billings ovulation method of natural family planning, we teach that ovulation occurs at the peak of fertility or the next 24 or 48 hours after the peak. Let me just take you through the process a bit. Each month, the pituitary gland releases follicle-stimulating hormone, which acts on the ovaries to stimulate several follicles. These follicles grow and secrete estrogen, which helps to thicken the lining of the uterus in preparation for pregnancy. Now, around the 7th day of the cycle, most follicles stop growing and only one dominant follicle, that is the one most sensitive to follicle-stimulating hormone, will continue to develop until the egg matures. By about the 12th day, this maturing follicle releases a sudden surge of estrogen into the bloodstream. So when this estrogen reaches the pituitary gland, it triggers the release of luteinizing hormone, which rapidly completes the egg's maturation and prepares it for release. So just before ovulation, the egg detaches from the follicle wall and the follicle begins to release chemical signals that attract the fimbriae. So the fimbriae will be the finger-like ends of the fallopian tube. So it will attract it towards the ovulating ovary so that it almost completely surrounds the ovary, because at this time it's already highly active and swollen. Then the pressure of fluid inside the follicle causes it to swell and then it eventually bursts, releasing the egg into the surface of the ovary so that the fimbriae sweep over the ovary to pick up the egg and then guide it into the fallopian tube. So once the egg is inside the tube, some gentle muscle contractions would move the egg towards the uterus. If sperm are present, fertilization may occur in the tube. If fertilization does not happen, the egg will continue its movement into the uterus where it is reabsorbed by the body. So where does menstruation occur here? Later, menstruation would happen when the endometrial lining, which had been thickened by estrogen in preparation for implantation, breaks down and sheds because no pregnancy took place. So remember that menstruation and ovulation are two separate events, and not every bleeding a woman sees that is described as menstruation. If you would like to know more, watch our video on Fertility Wisdom Wednesday, where we shall explain the different types of bleeding, and then you would have a clear understanding. Thank you for watching, and do not forget to drop your comments and questions in the comment section below. We will respond to all of them.